Let's move on to another contentious issue. The 902 billion shillings budget out to the health sector is being contested by activists. Now, a constitutional court order secured by CEHURD last year compels government to increase funding to the health sector. However, government planning documents indicate that the scheduled 2.7 billion shillings allocation will be trimmed to 1.8 trillion Uganda shillings. In studio today, we interview one of the lawyers from Center for Human Health, Human Rights and Development, that is CEHURD, Jordan Tumwesije, on the CAT. And he joins me right now in studio. Very good afternoon, Jordan.
Good afternoon to you, Romeo. Very happy to be here.
First of all, Jordan, what do you make of these CATs from 2.8 trillion Uganda shillings all the way to 1.8 trillion?
I think the cuts are very outrageous, and indeed, definitely they are going to have an impact on not just the person who has access to health insurance, but especially that mother in the rural area who relies on government aid, who relies on government hospitals in order to access healthcare. Yes. What
will be the biggest impact of all this on the health sector?
So the impact is going to be huge because when you look at the health sector development plan that was developed, government was looking at funding, was looking at staffing, an increased staffing of health professionals coming up to about 80%. But as of last year's health indicator report, it shows that this was standing at about 73%. Which is a long stretch, a long way away from the anticipated 80%. When you furthermore look at the NRM manifesto, they had thought that we would have an increase in access to universal health care, moving from 44% to about 65.6%. The impact of slashing this budget undermines all the above.
Indeed.
And indeed, when you look at the Constitutional Petition 16 of 2011, the case that the Center for Health, Human Rights and Development filed, where court gave explicit orders to government to increase funding on maternal health care.
But we would like to know right here on NTV at 1, why has government failed to comply with the court order?
So, of course, Romeo, I cannot exactly speak for the government.
Indeed.
I think it's very unfortunate that they failed to comply because this judgment came out in August last year, and the orders for government were very clear. Increased funding for specifically maternal health care, basic maternal health care, across all levels of hospitals. You know, previously it was up to a certain level, I think Health Center 3. But now the Constitutional Court was coming out to say, no, wait a minute, this basic maternal health care must stretch not just from Health Center 4 and 3, but must go down to Health Center 2, Health Center 1. Call it, if you will, Bonna Bazale. So it means if a woman, a pregnant woman, goes to a hospital, Health Center 1, the interpretation of that judgment is that she should be given basic maternal health care. But with the slashing of the health budget, this will not be possible because we will not have the supplies, we will not have mama kits in these hospitals, we will not have skilled health professionals working on these expectant mothers.
Jordan Tumwesije, many thanks for having made the time to speak to NTV Uganda.
Always a pleasure. Thank you.
Moving on with the bulletin, Uganda Law Reform Commission has launched a compendium of electoral laws to help in administration of electoral justice and in the wake of the electoral petitions arising from presidential to local government elections. The Attorney General William Byaruhanga, who officiated at the launch, said the